Gingivitis is an inflammation of the gingiva, so gums that are inflamed. We tend to think of it as kind of the early stage of gum disease, where we're thinking about that inflammation just kind of being localized more to the gum tissue, just kind of that collar of gum around the tooth. If gingivitis doesn't get treated, doesn't get managed, and that inflammation stays around, the plaque, the tartar doesn't get cleaned off, then it can pretty quickly move down into those next layers of the periodontium, affecting the bone, the PDL, and all of those surrounding support structures for the tooth. That's when we really start seeing what we call full-blown gum disease or periodontal disease. One of the challenges of gum disease is it tends to be something that doesn't have a lot of symptoms. So people don't tend to feel a big difference in the early stages of gum disease, but there are still things that we can see and that we can notice if we're paying attention. Some of the big ones are gums that bleed easily. If when you're brushing or flossing, your gums are bleeding, they're telling you there's something going on. There's some inflammation there. You may even start to see that the gums get a little more red, a little more swollen, maybe even starting to get a little bit of tenderness. You may notice that you're developing some bad breath. We're even starting to see some other changes with the gums. The gums are kind of pulling away from the teeth, or teeth are in later stages of gum disease. Permanent teeth can start to get loose or even look like they're separating, or even changing the way they kind of come together when you bite. These tend to be later stages of gum disease, but all these sort of things can happen. Healthy gums can be any number of colors. Just like our skin tone, our gum tone can vary based on our ethnic background, but they should be nice and firm. They shouldn't have any redness to them. They shouldn't have any swelling. They should not be uncomfortable. Most of the time, you should be able to brush and floss comfortably without having any bleeding or any real pain as you're doing that. Generally, healthy gums shouldn't bleed. Most often, if there's some bleeding going on in the gums, that's telling us there's some gingivitis, some inflammation of the gums. It may just be localized to one area, or it could be pretty broad throughout the mouth. But sometimes, like say you haven't been a regular flosser, but you're kind of starting to get back into the routine, you'll probably notice that at first your gums are going to bleed as you're flossing. But with time, honestly, usually within a week or so, that bleeding should subside. If you have bleeding that seems unusual for you, or it isn't going away with regular flossing, you should check in with your dentist or your physician.